name's Chuck Thompson. I'm doing my general assessment for my final exam. This is Tracy, my assistant today, and got our book out as instructed in the message you had sent, and we're following along with our assessment, starting with the head and face. We're going to start by palpating the scalp and the hair around the thing, checking for any kind of deformities, contusions, bumps, abrasions, or anything like this. Make sure everything is symmetrical. Going to work our way down. We're going to check for symmetry of the face. Smile for me. Awesome. We're going to palpate the frontal sinus, maxillary sinus, the temporal artery, which is present. We're going to get you to open and close your mouth and feel the temporal mandible joint. Go like this. Perfect. Go it again. Perfect. And the order I messed up, we have to do the frontal sinus and the maxillary sinus. Is there any kind of tenderness when I palpate there?
No.
Awesome. Moving on, we're going to be going on to the eye. We're going to, first we're going to check make sure the pupils are pearl and reactive. And they are, and they're approximately about 3 to 4 millimeters apiece. We're going to check the extraocular muscles by doing the six positional positions of gaze. So I want you to watch this, follow this with your eyes, okay? We're gonna go, don't move your head, just your eyes. And we're looking for any extraordinary movements. Perfect. We're going to make sure check the external structure of the eye, the conjunctive, make sure it's nice and pink up in here, not pale. It looks really good as looking at it. I already checked the pupillary response, which they were pearl, which is pupils are equal, round, reactive to light, and they're basically about 3 to 4 millimeters apiece. Now we're going to take the ophthalmoscope. We're going to check for the red reflex of the eye, the disc, and all that. And each eye, just look straight forward at my nose. It all looks good. Moving on, I'm going to change over the otoscope attachment for the ear portion of it all. But I'm going to first check structure of the ear. Any pain or anything upon palpation of this?
No.
Awesome. We're going to push down the tragus for tenderness. Then we're going to inspect the ear canal, looking at the tympanic membrane. Tympanic membrane is intact. No inflammation noted. Very little earwax noted. Same for the left side. Little reddening on the external ear canal on this side, with a little on this side, with the little wax noted. Tympanic membrane is opaque, just as the other. Looks good, other than the slight reddening in the external ear canal. I hit my head on the structure. Good laugh for you. Just look straight ahead. Can you hear me okay if I talk like this?
Yes.
If I'm on this side, can you hear me
Yes.
okay? All right, whisper check is good. Moving on to the next side, we're going to inspect the nose for symmetry. Make sure there's no pain upon palpation of either nair, and everything is symmetrical there. Going to just kind of look up here to make sure there's no inflammation noted. Everything's clear, no mucus noted. Nice and pink. Moving on from there, going to septum was intact and not deviated anyway. We're going to check the mouth and throat area now. Let me get you to open up your mouth. Say ah.
Ah.
A little bit bigger.
Ah.
Perfect. Tonsils are intact. No reddening noted. Everything's nice and pink in there. We are going to, I need you to say ah one more time, and then stick out your tongue. Say ah. Stick your tongue out your mouth.
Ah.
Awesome. Well, I forgot to bring some gloves. This is my wife, so
You want
going
to
to
go
palpate.
get some?
I'm good, sweetie. I
I
appreciate
can run
that.
some.
Go ahead and get me some, Brie. Thank you.
Where are they, Daddy?
They're in the laundry room.
We gonna run and get some?
Yes, please. I'm going to palpate the mouth of the patient here. Make sure everything is okay. No pain or anything noted. We all good, ma'am?
Mm-hmm.
All right. Then we're going to check the neck area. Going to be checking the lymph nodes. Feeling for any kind of swelling, lumps, or swelling or lumps, or any kind of abnormalities, any kind of extra pulses that were not supposed to be there. So we're going to check carotid pulses. Both intact +2. Make sure the trachea is midline, and it is. Now I want you to push your head forward against my hand. Awesome. Take your head back. We're checking the range of motion, by the way. Relax. To the right, to the side over here. Now to this side over here. Good. I need you to go ahead and do the shoulder shrug. Lift your shoulders up. Awesome. Now keep me from pushing them down. Awesome. I need you to look all the way this way. I need you to look all the way that way. I need you to look up. I need you to look down. Any pain or discomfort while you're doing that?
No.
Awesome. Now I'm going to step behind you. I'm going to check your thyroid. Look straight ahead. No swelling noted. All right. So moving on to here, we're going to check the chest posteriorly and looking for any kind of skin lesions, any discoloring of the skin, any weird shaped moles, and nothing is noted on that. I'm going to get you to take a deep breath. Take a deep breath in and blow it back out. Everything seems symmetrical, nothing out of the ordinary. Going to palpate the spinal process. Let me know if there's any pain. Okay, all good. Using 2 fingers, I'm going to percuss over the lungs, 2 fingers, and then tap with my other. Go ahead and take a deep breath for me. Again. Breath sounds are clear and equal on the back side. No adventurous noises noted. Now we're going to expect the front side alleviating, not doing the breast exam as instructed.
Daddy, I've got gloves in my pocket.
Thank you, Bray. We're going to, again, check for skin characteristics of the chest. In normal cases, we'd have this patient exposed, being looking at the skin.
Free pair in case you need them.
Thank you, Bray. We're going to palpate along the areas that we can palpate for the camera purposes, checking for any kind of pain or discomfort, any kind of lumps or masses. We're also going to listen to the breath sounds on this side. Deep breath. Comparing the upper lobes first, followed by the lower. want you to lean forward, and I want you to take a deep breath and exhale forcefully. I'm checking for murmurs. Okay. Alright, so from here we did a range of motion for the hands, wrist, arms, and shoulders. Again, I need you to take your hands straight out. I need you to push up against my hands. Perfect. I need you to push down against my hands. Awesome. I need you to take force out this way. Okay. Now go in. Awesome. Just your wrist up. Awesome. Just your wrist down. Good job. We're checking for capillary refill. Temperature, patient is warm. Capillary refill is less than 2. And we're going to compare the radial pulses. Equal and plus 2. Brachial pulses. Equal and plus 2. We're going to check the jugular vein pulses, and so you're going to turn your head slightly this way. Actually, let's do this. Let me go ahead and have you lay back this way, head back this way. Look this way. Now look this way. No jugular vein distension noted. Pulses good. Do not measure pressure. All right, so from here, using the bell, going to listen for. Actually, first we're going to inspect the pericardium for pulsations or heave, which look. No pulsations noted. From here, we're going to palpate the apical pulse. It is good. About fifth intercostal space. From here, we're going to palpate pericardial thrill. And we're going to auscultate the apical pulse. And we're going to auscultate around the diaphragm, studying different heart sounds. Okay. From here, going to expose the abdomen. We're going to inspect the contour symmetry of the skin characteristics. Skin's good, some freckles, good color. She does have one little spot right here that's been checked out in the past. I just noticed because it's my wife, and it is okay. She's going to, her umbilicus is fine. There's no pulsations are noted. First thing we're going to do before we palpate, we're going to auscultate breath sounds. Abdominal sounds. Bell sounds are active in all quadrants. We're going to listen over the aorta. We're listening for vascular sounds over the aorta, renal arteries, iliac, and femoral arteries. From here, we're going to percuss all quadrants. We're going to check the liver. No hypermegalia noted. And the spleen. Now we're going to deep palpate all quadrants, checking for any kind of pain. We've already palpated liver and spleen, kidneys, and we're checking for aortic pulsation. Nothing out of the ordinary. Going to check the femoral pulse. I'm sorry, you're ticklish. Present on the left. No swelling noted in the equial nose. Present on the left, present on the right also. So basically, we're going to expose the lower extremities, but we can't use the pants on. We're going to be looking for color, anything out of the ordinary on our lower extremities. Her hair, she shaves, so there's no hair there too, to see if there's any kind of hair loss or any kind of vein disorders. We're going to check her pulses. Pedal pulses are good. I need you to separate your toes for me. Perfect, perfect, perfect. All right, so going to get you to lift your leg up. I want you to push it down against me. Okay, now push it up against me. Awesome. Bend your knee slightly, bend your knee forward, up, towards, fight against me, this way. Awesome, now down. Awesome. Now push your feet against my hand and pull against it. Perfect. Same thing, lift your leg up, fight against me, at the hip, up. Okay, now down. Awesome. Now kick up. Awesome. Kick down. Awesome. Push away like you're doing a gas pedal. Pull towards you. Awesome. Now we're going to sit you up. Turn your legs this way. Beautiful. And we're just going to check sensitivity on you. You feel this okay?
Mm-hmm.
You feel this okay?
Mm-hmm.
All right. Nice light touch.
Mm-hmm.
Okay. I need you to take your fingers and go like this. Your finger to your thumb, both hands. Finger to the next finger. No, lift your, there you go. Next one up, next one up. Take your hand straight out. Look forward at me. Close your eyes. Touch your nose with your right hand. Touch your nose with your left hand. Perfect. I need you, close your eyes. Tell me what you feel in your hand.
A napkin.
Okay, same thing on the other side. I'm changing objects.
A napkin.
Good. See, I was trying to trick you there. Did the finger to nose test already. Did the fingers deep tendon reflexes. We're going to check the deep tendon reflexes in your arm. Just slightly relax your hand. Okay, we're looking for movement in the thumb. Good. Good. Relax your hand. Good. 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 All right. Now we're going to do the lower extremities. Relax your feet. Relax. Perfect. Relax. Awesome. Good. Good. And next, Babinski. Good. Now I need you to look for varicose veins. You have been blessed not having them. Very lucky person. Same thing on that side. From here, I'm going to get you to stand up. Walk this way towards me. I want you to walk away from me. And then walk back. Awesome. Stay just right where you're at. Now I want you to walk on the heels of your feet towards me. And turn away and do the back. Awesome. Now I want you to come over here. I want you to stand, but if you need balance for just a second, I need you to lift one leg up off the ground. See if you can stand. Awesome. Now the other leg. How's your balance feel?
Better on the other side.
Okay. So I need you to hold the edge of the table and bend down like you're doing a squat with one leg.
One leg?
Yeah, like this. Just a little bit.
Like that?
Yep. Do it again.
Other side?
Awesome. Now I need you to bend over and touch your toes. And come back up. Perfect. And I believe, I need you to go to your left side, lean to your left side, lean to your right side, need you to lean back, also lean forward. Perfect. Go ahead and have a seat back on one table, and that'll be it. Thank you very much.